And I have this special guest, an amazing cover doc for Dental Entrepreneur in our spring edition. It just came out last week. We're getting ready. This is our first promotion. So I hope you will help me in welcoming my esteemed, lovely, wonderful dental entrepreneur, Dr. Bianca. Hello.
Hi, how are you?
I'm doing great. I'm doing great. Oh, what a great little name for this guy. How old is he, Bianca?
He's going to be 1 year old on June 1st.
On June 4th. Oh, it's coming up. Oh my gosh, he's such a busy little guy. I know you love spending your mornings with him, and I appreciate you taking a little time with us.
I know. I know. You get to see me like be in action. This is like the day in the life, you know, trying to multitask and, you know, it's just, especially as a working mom, I'm just trying to squeeze in as much like time as possible. There are a lot of sacrifices that I make, you know, being working and like crazy schedule, trying to, especially because my business is still in its toddler years, you know, my office is 4 years old. And, you know, but like I said, and one of the last lines in the story is like, you can have it all. You just need to give it all and, you know, make it your passion and have good support and just balance it all out.
You know, I loved your article so much. And it was funny because you pivoted, didn't you? Because when we first got to know each other, COVID didn't even exist. We didn't know about it. And then by the time it came to publication, and I was so happy that you actually, you know, pivoted and opened up with, you know, your thoughts on, you know, what the world is going through right now. So thank you for that.
No, I mean, especially with how everything's I feel like it's weird when you don't talk about, right? Yeah. This is like our new norm, and like to not address it and how that it fits in our life right now. I mean, I felt like it was a big part of the story, or like my evolving story, you know?
Of course, of course. And I loved it. There's so many great things about your article, and we've got it. We're scrolling down at the bottom. So those of you that haven't seen the new article featuring Bianca, please go to our site and read her article. I was so impressed with you. And, you know, we found each other through a couple of different people in the industry. I know David Rice and Dr. Lucas Shapiro recommended that you would be a great cover doc, and it certainly panned out to be. So tell us a little bit about how you landed where you are right now, and then I want to hear how you're doing in this environment.
Well, like I outlined in the story, I mean, I originally am from New York, and then decided to take a leap of faith and take on an associate position working here in Las Vegas, and that I knew I had to chase the opportunity. And as I've been done a couple webinars talking to dental students, also sort of trying to promote, telling them about the cover. And, you know a lot of students out there are concerned, like, what about my future? You know, and I'm just like, you know, you need to follow your heart. And that's what I did. I trusted my instinct. I followed the opportunity, and so many doors opened for me when I came here. And, you know, I don't have any ties over here, but if anything, my family recognized that we created a place, a home over here. So now my family from the East Coast moved out here, and so Vegas is home now. I have my practice that's 4 years old. I was able to start my little family over here. Billy's, like I said, turning 1 year old, and so it's so many blessings.
So many blessings, but you have such grit. I mean, you're never giving up. So you had your. Tell me this: did you have your dream mapped out, or are you just the type of person that you just say yes, and when the opportunity opens, you say yes again, and you say yes again? How do you work that? Because everyone's got a different way of getting where they want to go.
That's a really great question. I mean, I think that, you know, I definitely did have my dream mapped out. You know, you have like a loose framework, you know, but it's so hard to predict all the fine details, right? You're like, okay, I want to be a dentist. I want to be a practice owner. I want to be a mom, but you don't know how all of those things are going to fit in. And so I am very much so a believer in being a culture of yes, you know, or yes woman, right? And I think that has provided me so many opportunities. So I'm like, okay, I want to be a dentist, but I didn't know in what way I would be practicing. So like, let me continue to explore the opportunities, said yes to each, each job option, each mentor that seemed to fit with my vision and my personality. And so, by continuing to sort of surround myself with good people who had the same, vibes as me, I think that really helped direct me to where I am today.
Well, plus you got involved. I think that's such a good, good recommendation for the young dentist. Get involved, because if you weren't involved in ASDA, you weren't involved in the organization, you wouldn't have met so many amazing people. And I think people don't realize how many amazing people are involved in organized dentistry to get us started, to get us our community. And then you can move to different communities, right? But I mean, you got to get started somewhere.
So true. I mean, the older I get, or the more involved in the profession I get, I realize that dentistry is a small knit community, and you definitely can't burn any of your bridges. And if anything, like, you can leverage those contacts to help get you where you want to be. Especially for me, I do work with Pacific Dental Services, right? So that's a dental organization, and I feel like it's easy to feel, get involved in that little bubble. And, I wanted to make sure that I'm still, my voice is being heard as a DSO doc in the organized dentistry, but also it's important for me to see what are the viewpoints of everyone else around me, what our field is going through. So I think like I sort of outlined in my article, I feel like sometimes it's easy to pit up like private versus, corporate, or, residency versus working, or I feel like everyone always wants to try to put some divides or categories in place, but if we remember that in dentistry we're all in it together, we all serving our community, and so
yes, I love that.
It unifies us,
I love that, because that makes everybody better, doesn't it? Because if we just had pigeonholed like, oh, that only you can't go there, I don't feel good about this. I mean, it's your journey. You want to do the best dentistry you can, and this was the best opportunity for you. And look at you, you bought your practice, you're running it, you're running life. I mean, you're spinning plates. You're still. I love that you're still so positive, and the opportunities are always evolving for you. I think that's, your goals are just getting going. I mean, one goal at a time, but who knows where you're going to end up here, right? I mean,
well, thank you, Anne. Well, you know what, like when the start of pandemic hit and quarantine hit, obviously we're all scared. And, one thing that I told myself, and my mantra for the first couple of weeks of quarantine was that, things work out the best for those who make the best of how things turn out, and so, when one door opens, another one closes, and I found in this time the people who have been able to be the most successful, and of course, I'm not trying to underscore, obviously the graveness of the situation, because everyone's been seriously affected, but, people who've been able to innovate, adapt, looking at restaurants who are able to quickly turn their establishment into like a DIY service, or, I saw restaurants doing like home cooking, and they're just trying to find ways to make themselves, stick out and
relevant, right? It's actually people don't realize this was a defining moment for everybody, right? We're never going to forget this. And so how are we going to remember how we spent COVID-19, right? I mean, you can crawl up in a ball and you can, hide in the closet occasionally, an hour or so, whatever. You got to snap out of it, right? You got to snap out of it, because first of all, people depend on you. Your team depends on you. I would say that the world depends on you because of your light and your chutzpah and your drive and your all the things that you've got going. I mean, that's why you're on the cover of Dental Entrepreneur, because you epitomize what we see as a young dental entrepreneur achieving her goals. And I see that you also are on the path to give back, because I want to talk a little bit about the Oral Health Minute, because that was kind of cool. And that's how you came to the mind of so many. You just tell us about how that started and where we can find it, because I think that's just a great idea, and I think it's going to change a lot of people's lives in expectations of dentistry.
Yes, I mean that's exactly what my goal was. I remember when I first graduated dentistry and started working, and I would do these like super clinical case presentations. And I remember my mentor, who I was working with at the office at the time, Dr. Muggleston, who I mentioned in the article, and he was just like, "You're not acting like Bianca. Like, no wonder your patients aren't starting treatment. You're not acting like yourself." And I didn't understand what that meant at the time because, when I'm learning, I was just so, stiff. And now I remember as I was able to, like I said, and I tell my dental students that I'm talking to all the time, I'm like, with, competence comes confidence. And I didn't, I was just a new grad, so I didn't feel that confident in myself yet. And so, I lost my personality, but, quickly I learned that, you can't speak clinical jargon to patients. They don't understand what that means, and one of the number one reasons patients fear coming to the dentist is they feel like, they're being talked down to, or they don't understand. And so I wanted to partner with my patients. And so that was really, Oral Health Minute evolved because it's how I learned how to talk to my patients, in a way that's fun, relatable, easy to understand, analogies.
Yes, that's so clever. It's one of the mantras I use for Bianca, which you will love. You fake it until you believe it, and eventually you master it, right? So you just have to, know what you want to do, and then you figured out a way to do it. And I love that you had a mentor that was helping you see that, because it's just about you being authentic, right?
Yeah.
I mean, yourself, you can kind of let go of all I have to speak a certain way, I have to talk a certain way. You can be you. Yeah. You are perfect the way you are. You just happen to be a dentist, and a very good one. So, you're still a person, and you still have feelings, and I think the key, we're really in the relationship business also. We're caring, we give, but if you can't form a relationship with that patient, then it doesn't feel right, does it? I mean, we don't want anybody to do anything that they don't want to do themselves. I mean, I think
absolutely.
It's just,
and so, I was thinking about how I would create these videos, and I remember, nowadays in social media, not everyone has the attention span for anything more than 5 minutes. So I was like, okay, I got to make this quick and fun, give it the opportunity to go viral, get a lot of hits. And so it eventually evolved, and it's cool. Like you said, I didn't realize when I made these videos at the time, I thought it was just for fun. I didn't realize it would connect me to you eventually, right? And and our patients love it, and it's super cool to know that other providers respect it as well, like to show it to their patients. Like, again, sometimes I think we forget that we can have such a bigger impact, and that's the beauty of social media. It's beyond my own community. It's the world.
It is. And I think when you finally hit on that you are being yourself, and it was something you wanted to do for fun, I mean, that's the beauty of the social media, because you finally you can't, I don't think you can be successful if you're being somebody else. And I think this is such a great way for the general public to learn a little bit about how fun, how cool, how important dentistry is without being afraid. And that's everybody. I think your post will help everybody talk to their patients, and ultimately help the whole profession. It's really cool.
No, especially like right now in midst of the whole, COVID-19, and as legislation is being passed to determine what is the need of everything. I think it's important that I'm happy that more and more people are realizing that you cannot have good overall health without having good oral health, So dentistry is, like you said, an important part of our healthcare system, and dentists are key role in that. So
I think people are going to get that. I mean, we've been trying to push that and meld that together for so long. Maybe this is going to be the last little piece that'll help us get over the hump, when people will realize that. And I think hopefully, when they go in, tell us how it is when you're going back in, because I just read an article that was saying, when you go to the dentist now, it's going to feel like you're going into a hospital operatory room, right? So how have things changed? How long have you been back? Is the team back? Tell me a little bit about that.
Sure, great question. So my office stayed open the entire
Mm-hmm.
quarantine for emergency only, which was weird, you know. I mean, like, unfortunately, I did have to, you know, furlough a lot of my staff just because there wasn't the volume for there. So I was just running as a skeleton crew to serve our community. But in that time, we were able to master a lot of the new safety protocols, and then just become comfortable, you know. And so May 4th, so just last week, we were able to open up and resume seeing dental, you know, elective dental care again. We're going to say bye to
Okay.
Billy. and
Oh, I love it. No, bye, Billy. See you a little bit later, Billy. Welcome.
but so as we were able to see more patients again, you know, it was good because my skeleton crew was able to master all of the new protocols before we start bringing more people back. But it is crazy, you know, we're having patients wait in the car. We're doing extensive screenings. We're doing their temperatures. They have to wear masks, hand sanitizer. Then they do a rinse. And it's like all these new, like 15 minutes of added protocol. And then obviously us in our full PPE, double mask, gowns, all this stuff. So it's a lot. But at the end of the day, I mean, we just want to make sure everyone's safe and comfortable. Because like we do
So
have,
how,
yeah.
yeah, how are you
Okay.
feeling about that? Is it feeling like, is it kind of getting normal then? Because you have been kind of in those trenches since the beginning. You feeling good and you're feeling a little normal, back to work?
You know, it's still not back to normal. It's definitely not business as usual, unfortunately, because we are still, you know, we're not allowed to do any cosmetic, at least in Nevada, right? Each state has its
Okay, every
own.
state's different. Yeah.
Yeah, and so we have our own restrictions, and I don't have the full team back yet, just because, again, I'm just trying to do this incremental bring back just to make sure everyone's safe. And, you know, and patients still, you know, I would say 50-50. Patients are excited to come back because dental emergencies will always happen. There's always going to be need for
Right.
surgery. But the other half as well is then some people are still afraid, or, you know, so, or they're in the high risk zone. So we're trying to, you know, wait.
Well, I
So
think that's smart because I think soft opening is the way to go. I mean, I think everybody, you just get a little soft opening, get a little bit more, you know, comfortable with the new normal. And, you know, it's funny. I ran into one of our patients the other day, and it was interesting. I think you're going to have those that are afraid. This patient in particular said to me, you know, I met her and I ran into her at the post office. She goes, we've had watches on this one tooth, and now I'm like so mad at myself. I didn't get it taken care of before COVID because now I'm chewing on the other side all the time. I'm really worried, and so I thought that's good for dentists to hear, and the teams to hear, because that's something I didn't think about. Yeah, a lot of the people that we've been looking at a tooth, or we're going to take care of that, or we'll watch it for next year. They don't want to wait anymore because if they wait, they may not have the opportunity to get that fixed, and that tooth might be, you know, way more expensive, as we have been telling them, and all these other things. So I thought that was kind of cool to hear that she was excited to get back. And you're going to have people that don't care. They're going to come in, they just want to get their recare appointment, which, you know, that is not an emergency, but they've, you know, so you have to manage all of those things too, I think, right? And, you know, between what needs to be done, what truly needs to be done, and what they want to have done, and what we want to do, because I know you specialize in a lot of beautiful cosmetic dentistry, and you know, that's going to be on your heart going forward too when your patients come in, right? Because
yeah.
for this, once we get into the groove, I feel like they're going to be flooded to the dental office, because we realize time is precious, it's priceless, and what are we waiting for, right?
No, you're absolutely correct. And, you know, it is interesting because, like, a lot of the dental emergencies that I saw where patients were like, these are things that we were watching, you know, I told them about months ago,
Right.
and they didn't get it done. And so they're like, I should have listened to you now because I'm in emergency. And now it's, you know, obviously a more precarious situation. So they're like, how bad is it to, you know, and, you know, it has to be really bad if they're coming into the dental practice because they've ignored it for so long. And so I agree. I mean, I think once we're able to get back into the full swing of things, there's plenty of dentistry to be had. There's going to be a need, especially with the neglect that has been happening over the last couple of months. So
yeah, I think it's going to give us more stories too, and more, you know, sometimes we need to hear those stories, don't we?
yeah.
I mean, we don't see them like all at once, right? So you're
Right.
seeing the emergencies come in, you know, I think it's going to even help you be more confident in your diagnosis and your explanation, and you'll have stories to share, because stories, you know, I mean, you could say what you want, but stories sell. And we know what's the best. We know what's best for the patient, but ultimately we want the patient to make their minds up and their decisions. So how can we nudge them a little more? And it's going to be through those stories that you've seen unfold,
Yeah.
right? So tell me, okay, so I'm going to get you. You got to get back to. You're going to work today, so the Oral Health Minute. How can all of the people that are watching this, and we're going to be watching this all over our platforms, find the Oral Health Minute?
Sure. So they can find me on Instagram. So that's my primary platform. So it's at Dr. Bianca Vallejo, or you can look up the hashtag Oral Health Minute. Otherwise, you can find me on YouTube as well. And same thing, just look it up, Dr. Bianca Vallejo, Oral Health Minute.
Wonderful. And you've got your bio in the article, so they can find you there, and your beautiful pictures. And we're so glad we got to see that little beautiful boy, that Billy, and hear more about your story. So next time we come on, Bianca, maybe we can have your hubby do a little musical background for us. That would be kind of cool.
Okay, I'm into it. Make it a family affair. So.
Yeah, make it a whole family affair. That would be wonderful. Any closing remarks today, just to send everybody off to their work on this Friday?
Oh my gosh, I didn't even realize it was Friday.
It is, yes.
Well, TGIF, you know, I would just say thank you for having me, and let's all just continue to be human. And, you know, like I said, keep on trying to make the best of the situation that we're put in, and I think it'll work out for everyone.
Oh, I love that. And that's right. Thank you so much, Bianca, for joining us. And you bet. And listen, you hear that, everybody. Just be human. And as my closing, and keep doing you. Thanks, everybody. Be safe and stay sane.